Hi, I'm Laura Pankowski, and I'm going to do inserting a male foley and removing a male foley. So the first thing I'm going to do is I'm going to assess my patient's chart, and I'm going to make sure I gather all my equipment, and if I need an assistant, I'm going to get an assistant at that time. I'm going to perform hand hygiene and put on the appropriate PPE if I need to. In this situation, I don't need PPE, so I wash my hands. I'm going to come into the room, introduce myself to my patient, and I'm going to verify my patient. So I'm going to check their ID band, and I'm going to make sure I ask them, what's your date of birth and your full name. And once that's confirmed, I can start everything. So I'm going to close the curtains and make sure that I ensure privacy for my patient. And I'm going to explain the procedure to them. And while we're doing it, I'm going to ask them if they have any allergies to latex or iodine. And then I'm going to start the procedure. So the first thing I want to do is I want to make sure that I uncover them. I'm going to have their legs spread apart. I'm also going to make sure, I already did this, that the bed is at an appropriate working height. Usually you're up to your elbow, and I'm going to be on the right side of my patient. I'm going to make sure that they're laying flat on their back. Like I said, their thighs are apart. Then I'm only going to expose the area that I'm working with. So I'm going to show the perineal area, and I'm going to cover them up because I'm not working with this portion, so usually a bath towel will do. And then I am going to make sure that I put this drape underneath them. So in the event I had a person, I would say, could you lift up your butt for me? And they would lift up, and I would put this underneath them. Since it's a mannequin, I'm just gonna kind of position it. Sometimes they won't be able to move either, so you might have to find a way to get it in there as well. Okay, the next thing I'm gonna do is I'm gonna put on clean gloves. And then I'm gonna wash the area. So I wanna make sure that I get some warm water with some, light soap. We don't want that to have a fragrance of any kind. Or we're gonna get the moist, like towelettes that you can warm up, whichever. So we're gonna have this, and let's pretend for the video's sake that we have water in it. We're gonna kind of wring that out. And we're gonna wanna use a different portion every time. So if this is an uncircumcised male, we're gonna retract the foreskin, and we're gonna kind of go in circular motions around the head of the penis. And we're gonna switch to another portion. As long as you still have enough water on it, you should be fine. If you don't, you can dip it back in. And then we're gonna go downward strokes down the shaft. Like I said, we're just gonna switch the towel every time. Just kind of turn it to a new position, so we're not using the same one over and over. Okay, and once that's done, the instructions will either say something like let it air dry, or you can pat dry with a towel. So in this situation now, we pat dry, we remove this, and then I want to get rid of my clean gloves. We're gonna throw those away. And then I'm gonna just position my area a little bit easier for me personally. I'm gonna move my clean gloves over here. If I had, another space, I would get rid of this as well. Just kind of move everything out of my way, make things a little easier. And then I'm going to open up my catheter set. So depending on how, what kind of patient you have, you're gonna wanna make sure, this is a 14. So the 14 should work for this one. In other situations, we might need a smaller one or a larger one. And in that case, I'd bring another one with me. So we're gonna remove this. And I actually am going to save this. And we're gonna use it as like tiny disposable garbage for like my cotton balls and stuff like that during the procedure. Okay, and then we wanna, this is all sterile in here. So we want to avoid touching the inside. I'm going to move it this way so I have a place to put on my sterile gloves. So the only thing I can touch out of here is going to be the sterile gloves. We're going to move these over here. We're going to don the sterile gloves. We can just leave this here, we don't have to remove it. So we're gonna take these sheets. This is all sterile, so I can set this here. I'm gonna take the blue sheet, and we actually want this to be shiny side down. And we're gonna kind of do one of these cupping motions so that we're not touching anything to avoid the sterile gloves. This wants to not fall for me. Okay. And then we're gonna take this white one, and this one's actually going to go over, just exposing what we're using for the procedure. And then the last one is just to make my sterile field a little bit wider. Like I said, shiny side down. Okay. Now we can take the tray with the box and move it over to this side. We're gonna take the tray out. We're just gonna put it closer to make everything a little bit easier. And then what we're gonna do is we're going to, like I said, we already checked if they had a latex or iodine allergy. For the purposes of the mannequin, we wouldn't use iodine, so we're gonna set that to the side. So we're gonna take our hydrogen peroxide, we're gonna drench the cotton balls in it. You want that to really get on there. So then this is trash, I'm gonna throw that away. Then we're gonna take our lubricating jelly, we're gonna put that down, and that'll be for when we actually put the catheter into it. I'm gonna throw that away. Want to make sure that we remove the cap of the sterile saline. Throw that away. And then the next thing we're going to do is, this is when my hands are going to become sterile and clean. So my sterile hand is going to be this hand, and my clean hand is going to be this hand. Before I do this, actually, I'm going to remove the catheter itself. So we're going to kind of do a pull and a coil method. Okay. And then we can throw this away as well. We're going to set this into the lubricant. And then we're going to take that syringe from earlier. And we're going to put that in now so that when I have my clean and my sterile hand, we're not contaminating anything. Like I said, we don't want anything to touch the patient, so we're going to keep it in the sterile field. So this is when I'm going to have my sterile and my clean hand. So if the penis was uncircumcised, we're going to pull it back and retract it, and then we're going to hold this here. We don't want to let go. We're going to grab our cotton ball that is already saturated, and we're going to go in circular motions. We're going to dispose of that. Again, all the way down from the meatus to the shaft, avoiding touching with my other hand. Okay? And then we can also dispose of this. I'm just going to hang on to it for the purpose of if anything goes wrong. So we're going to set that down. The next thing we're going to do, we're going to instruct the patient to bear down as if they're having a bowel movement. And we're going to take the 1 to 2 inches of the catheter that we inserted in the lubricant, and we're going to insert the catheter. We want to avoid touching it still. If we find any resistance, we can just kind of turn it, instruct the patient to take a deep breath. And we want to get that into, once we get to the Y on the catheter itself. We're almost there. Okay. Now the next thing we're going to do is we're going to hold it. We want to insert all the fluid. Usually it's about 5 to 10 cc's. It just depends on the facility. And we're going to push that in. Okay, that's pushed in. We're gonna remove that. And then we're gonna let go, and we're gonna give it a little pull till we find some resistance so we know it's in. We're going to attach this to the patient's leg, so we want to first move this. We're gonna put this down so that it's lower than their bladder and attach that to the bed. And then we're going to take the leg strap that I have already grabbed. And then we're just gonna inform them, I'm just gonna put this on your leg. They shouldn't feel any discomfort with this. It's just like a garter almost. And we want it to be tight enough where it's not gonna fall, but we wanna give them, enough room so that they can move their leg around. And then we wanna make sure that we attach this by leaving this out. We want a little bit of slack as well. And then we are going to attach that. And then we're going to clean everything up, dispose of everything that we have, ask the patient if they're comfortable. So we're gonna technically dispose of this, but for purposes of the video, I'm going to keep it. We're just gonna clean everything up for them. We would just remove this off of it by ripping it. We wouldn't wanna feed that through the catheter. So let's say that we cleaned everything up, and I would cover the patient back up, make sure that I raise them back down. I would take my gloves off, and then I would perform hand hygiene. And then now we're gonna do removal. So to remove it, again, we're gonna do about the same steps as earlier. I'm gonna check their chart, I'm going to come back, everything that I did previously, raise the patient back up, and then we're going to pretty much start everything over. So I'm going to put on my clean gloves. I've already gathered my equipment. My equipment is still from the last video. So I would already have the syringe with me. Got my gloves after I performed hand hygiene. We only want to expose the part we're working with again, so we already have this set up from the last one. We're going to actually remove everything in the bag first. We don't want there to be anything left in the bag. We're going to measure it, so that way when we're done we can just wrap it up, toss it out. So I'm going to come over, I've already explained what we're going to do to the patient. I'm going to unattach this, and then we are going to withdraw the fluid that we put in when we put the catheter in. We want to make sure we get about the same amount. So the last time it was about 8. So we have that. We're going to remove the syringe. We don't want anything to go back in. And then we are going to instruct them that this might be a little painful, might burn a little, just to, hold their breath. And then we're going to pull it out quickly. We're going to perform any, we're going to dispose of this, like I said, in a biohazard. So this goes biohazard, boom, it's gone. We're going to, again, clean up, perform more washing. We want to make sure we clean the area for them if they would like. And then we're just going to, remove everything that we had previously, throw everything out, ask them if we can do anything else, put the blanket back over them, give them privacy. I'm going to remove my gloves, and then I'm going to perform hand hygiene. And that's it.